Good evening, everybody. Dr. Nathan Thompson here with Exemplify Health Center, your Wellness Way affiliate, right here in Yorkville, Illinois. Happy Monday evening, guys. I hope you guys had a great weekend, and I hope you had a great start to your week. If you are joining us right now, please make sure you say hello. Let us know where you're watching from. I'm going to talk about something really interesting tonight. I'm going to talk about arthritis, mainly because I hear all of these different reasons why people have arthritis. I'm going to show you why I disagree with almost all of them wholeheartedly, and I'm going to show you where to look instead when it comes to arthritis. And arthritis is a big deal in the United States because it almost seems like people are having degenerative joints already into their 20s, and I'm going to show you guys it really has nothing to do with old age. It really has nothing to do with overuse as well, and I'm going to show you again where to look instead. So again, if you guys are watching us and joining us, please let me know where you're watching from, and please just say hello, and that way I always know where people are watching from. It always helps me when we are doing these live videos. So part one, is it really overuse or old age? And I'm going to kind of dispel some myths, and I'm going to show you arthritis again from a different perspective. And if you are joining us, again, please say hello. And also, while we wait for people to jump on right now, please make sure that you guys are following Dr. Nathan Thompson on TikTok. We got some really interesting videos on there. We do a lot of short version videos. In fact, I'll talk about arthritis again with a 2 to 3 minute video probably tomorrow, so watch for that. Again, if these get taken down off of Facebook, you will be able to find them on YouTube, definitely on Rumble, and I'm also on True Social right now. And just go ahead and type in Dr. Nathan Thompson. And again, guys, if you are from all across the country, please make sure, guys, because I know that our schedule as far as new patients not local in the area is completely filled and completely booked. So again, make sure that you go to thewellnessway.com. You can type this, go ahead and click this button right here, or find a clinic, one of those two, and you can be able to consult one-on-one with a doctor or find a clinic that's going to be close to you. And if there is not one close to you, there's also some wonderful doctors who think parallel to the Wellness Way approach, who can be able to work with you remotely as well, either through phone or Zoom. And then also, please make sure you're watching my friend and mentor, Dr. Patrick Flynn, on Saturday morning, 8 o'clock, with a different perspective. You'll be able to watch that at thewellnessway.com. And please make sure right now, they did a wonderful, wonderful review of breast cancer, especially, and went into a lot of detail in regards to that, and really dispel a lot of the myths that are associated of what we think are the true reasons behind breast cancer. But I know through this, your perspective will be completely different. So make sure you go to thewellnessway.com and find a doctor to be able to work with. Unless you are from the Chicagoland area, then please reach out to us as well. So arthritis part one, is it really overuse or old age? A reason why I'm talking about this is because, there's so many people who think that arthritis is overuse, or because I'm just getting older. And let's dispel those myths by actually asking questions, guys. And I really think that one of the ways in order to start thinking differently is just ask questions about specifically those myths, okay? So let me ask you your first question. If arthritis is due to this whole idea of overuse, then why do some people need a knee replacement when they've never squatted more than getting off of a toilet 1 to 3 times per day, okay? Something to think about when it comes to that. So these people, they've never ever squatted, and yet they think that it's because I've overused my knees. I'm going to tell you something. I squat, and I squat a lot, and my knees actually feel better at 45 than they did at 25, 20, 15, or 30 or 35 years of age. And actually, I use them, okay? So I'm actually using my knees more because joints are supposed to be moved in order for them to be nourished, okay? Question number 2, if arthritis is due to old age, then why do some people get a hip replacement in one hip, but they don't get it in the other? That's weird, because both hips are actually the same age, right? Conversely too, why do some people need hip replacements at 60, some people need them at 80, and some people never need a hip replacement? So if it truly is due to old age, then all your joints would wear out at the same time. They would wear out symmetrically. You would get both hip replacements or both knees replaced at the same time because they're both the same age. Here's another question. If arthritis is genetic, then why on earth have I not had back surgery yet? Because I come from a family who all had bad backs. And in fact, my dad had spinal surgery at 32 years of age. And I remember, and I love my parents dearly, but I remember, my dad and my uncle, who also had a bad back, said, you just wait because your body's going to fall apart when you're in your 30s and you're going to have a back surgery as well. And so many times we argue just so vehemently on why I need this surgery, why I need this. Well, the doctor recommended it. Well, what does your doctor do? He's a surgeon. Well, of course they're going to recommend surgery then. So if it's genetic, then I have the same genetics as my father, but I'm 45 years of age and I've never had a back surgery. Yes, I've had back injuries before, but also being 45 years of age, I can also pick up almost 500 pounds off the ground. Meanwhile, people would say, oh, you should never ever do that if you have a bad back. So guys, we just want to ask questions to help you guys start thinking a little bit differently. And I'm always going to say this, guys, because there's always going to be people who say, yeah, but you don't understand my situation. And I'm going to respond by saying this, guys, if you want to continue to argue for your limitations, the great news is that you get to keep your limitations. Argue for your limitations and you get to keep them. Which is why I always tell people is say, listen, if you're going to argue as far as why you're sick and you're going to blame it on some kind of external reason why, then the bad news is that you're never ever going to get better. The good news is you'll feel really good about being sick. So let's start thinking differently. And on top of that, let's start opening up our minds. Let's start opening up our hearts to different possibilities rather than to keep just vehemently arguing on why we should actually stay sick. So let's talk about arthritis. And this actually comes from the Mayo Clinic. Where I'm from, if doctors can't figure out what's wrong, everyone goes the 6 hours and drives up to Mayo Clinic, who are actually very good clinicians when it comes to diagnosing things. But I'm going to tell you something. They may give you the diagnosis and you'll say, thank God, now I have a name to my condition. But guys, the treatment is still going to be the same. It's still drug treatment approach by putting out a fire. So here is what Mayo Clinic actually says about arthritis. And I quote, arthritis is the swelling and tenderness of one or more joints. The main symptoms of arthritis are pain and stiffness. So I have a painful and stiff joint, which typically worsens with age. Now I actually disagree with that because actually with what I do, let's just talk about the chiropractic aspect. Why can someone get 6 months older yet have less pain and less stiffness of a joint? They got older according to the Mayo Clinic, but how did they actually get better? So the most common types of arthritis are osteoarthritis and rheumatoid arthritis, which is an autoimmune condition. It's not the body attacking itself, though. It's an inflammatory condition, and this is something that will happen systemically versus osteoarthritis is typically happening in a specific type of joint. Now, treatments vary depending on the type of arthritis. The main goals of arthritis treatments are to reduce symptoms and improve quality of life. So basically what they're saying is let's just help you handle the pain a little bit better versus saying, why is that joint inflamed and what can we do in order to restore a life? That means that you're going to have it for the rest of your life, and I disagree with it. So furthermore, what the Mayo Clinic talks about is they talk about the treatment of it. Remember, this is coming from the Mayo Clinic. And the Mayo Clinic actually says the treatment focuses on relieving symptoms and improving joint function, which I agree with this, but how do they restore joint function? You may need to try several different treatments or a combination of treatments before you determine what works best for you. Now, when they say you need to determine, there might be several different treatments, you need to determine which one will work best for you. One of the main things is that they're saying, we really don't know how to treat this, and how we know whether it's working is whether your pain subjectively is actually going down. So they talk first and foremost about treatment, about using a medication approach. So they might use NSAIDs, non-steroidal anti-inflammatory drugs, can relieve pain and reduce inflammation. interesting about reducing inflammation. If you're using an NSAID, are you really reducing inflammation, or are you just blocking the inflammatory process? So examples include ibuprofen and naproxen sodium, which is also known as lead. Stronger, here's what they say, stronger NSAIDs can cause stomach irritation like ulcers and may increase your risk of heart attack and stroke. Well, I have news for you that all NSAIDs increase risk of heart attack and stroke. Now, the other thing that they use, according to Mayo Clinic, is use counter irritants. So this is things like Bengay or Blue Emu. Or basically, the whole idea with counter irritants is that they'll put something on that will irritate the skin, and you have what's known as a gating effect, meaning that you will feel the irritation of the skin, like heat, for example, and that will travel faster than pain sensations going back to the spinal cord. And the spinal cord can only process a certain amount of information, which means that it will only feel heat and it won't have the sensation actually of pain. Guys, this is actually why when you stub your toe on the bedpost, while you innately reach down and you start rubbing your toe, because if you rub your toe, the sensation of vibration will travel back to the spinal cord faster than pain, and it won't hurt as much. So you can use counter irritants. You can use steroids. Corticosteroid medications such as prednisone reduce inflammation and pain and slow joint damage. Side effects may include thinning of the bones, weight gain, and diabetes. So think of this. They also will add long-term steroid use. This is why they only say we can only inject this joint about 2 or 3 times, because you're going to see that you have localized osteoporosis in this area. But if you're using steroids systemically, basically what you're doing is you're trading in on reducing inflammation, which means I'm knocking out the immune system, and later on it's just not a matter of if, it's just when I'm going to have cancer, because remember, cancer is a disease of the immune system. And then they have disease-modifying anti-rheumatic drugs, or DMARDs. These drugs can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. In addition to conventional DMARDs, they also are biologic agents and targeted synthetic DMARDs. Side effects may vary, but most DMARDs increase your risk of infections, because what do? Because they knock out the immune system, which thus in turn decreases the inflammatory response. The whole goal is not to knock out the immune system. The whole goal is to figure out why it's inflamed in the first place and fix that, versus taking some kind of biologic or drug that has all of these different types of side effects. And I'm going to give you guys some examples. Here's the first one. This actually comes from the Journal of the American Academy of Orthopedic Surgeons of 2004. They said this: NSAIDs continue to be prescribed for patients as part of the recovery for healing fractures, even though using these medications have been found to diminish bone healing, bone formation, and bone remodeling. So if your doctor is still prescribing NSAIDs for any kind of injury, I want you guys to notice that when you are taking it, you're actually inhibiting the healing process of that area. You're basically robbing Peter to pay Paul. You're saying, I don't want pain right now, but all I'm doing is I'm actually extending and inhibiting the healing process. Now here's another one that comes from Neurology, May 11, 2004. These are some oldies, but some goodies. And here's what they said: near daily use of painkillers for 6 months, okay? For 6 months, just 6 months, it caused an increased likelihood for chronic migraine headaches by 20 times. It caused an increased likelihood for chronic non-migraine headaches by almost 10 times. Increased likelihood, for chronic neck pain, 3.5 times. Increased likelihood for chronic low back pain, 3.5 times. So the whole idea of taking painkillers for specific types of pain is actually causing more pain, and in fact it's known as a rebound phenomenon. Sometimes, guys, when it comes to pain, sometimes you got to realize I'm actually causing it by the medications that I'm taking. And this one right here, I've been talking about this for years, but this gets me so riled up, because heads should have rolled in regards to the whole Vioxx, but it never did. Nothing happened, okay? Except maybe a slap on the wrist and a fine, when in reality, they knew that they were going to kill people in the name of pain reduction. So if you guys ever heard of Vioxx, which was the revolutionary COX-2 inhibitor that was going to save the world from arthritis, and, you know, Merck came up with Vioxx, and then you had Celebrex, and then you also had Bextra. Basically, same medication, different company making it. But this is what's really interesting, and I want you guys to understand, is that when they're developing drugs based on a market, meaning there's going to be a need for it. They're not developing drugs in order to save the world, in order to necessarily benefit you. The only thing that they're trying to do is benefit their shareholders. They are publicly traded companies which have a vested interest in making earnings for their shareholders, which means they're not going to bring a drug to market unless they know that there's going to be a huge market for it and a potential to be able to make a lot of money. This was true when it came to Vioxx. So they pulled this off of the market back, October of 2004. So actually at the end of September 2004, Vioxx pulled from the market due to an increase in heart attack and strokes. Actually, a whistleblower actually said, we estimate about 200,000 deaths just from this medication. However, back in August of 2001, they already knew from looking at their research that patients on Vioxx were 4 times more likely to have a heart attack. They already knew about this, yet they put it to market anyway, and they understood here's how many people are going to die. And you know what? When we go ahead and we get the fines for it, we get the lawsuits, let's put some of that money that we make from Vioxx, let's go ahead and put that into a little kitty, and it end up being about 10% of their total profits, which isn't a really bad deal if you get to keep 90% of your profits and then pay the other 10% in lawsuits because people's lives were lost. So your grandmother, your grandfather, maybe your husband, maybe your wife, maybe one of your children actually had to either suffer incredibly with a heart attack or stroke or may even die, but it was all for the name of profit, which is why I speak out about this, because we've lost our way in healthcare. Healthcare today is nothing about the person. It's not individualized anymore. In fact, so many doctors, basically what they follow is they just follow a template, meaning if you have this on your lab, here's the medication, and what about diet, what about exercise? Yeah, do it. But I just had a patient today who said his insulin levels were 100 times more than what normal is. And he said, I've asked the doctor about diet and exercise, and they said, yeah, just eat less and lose some weight. But how? We're not going to tell you how, because they're not experts in the prevention of disease. They're experts in how to put out fires. So he's been basically putting out a fire for the last 25 years, suffering with diabetes that continues to get worse and worse and worse, and no one has any kind of exit plan. I'm going to guarantee you this. We have an exit plan for him because we're the world's best carpenters, hands down, within the Wellness Way approach. So the next thing is we know that NSAIDs, they're not a good deal. What about surgery, okay? So Mayo Clinic says if conservative measures don't help, doctors may suggest surgery, such as number 1, joint repair. In some instances, joint surfaces can be smoothed or realigned to reduce pain and improve function. These types of procedures can often be performed arthroscopically through small incisions over the joint. I'm going to talk about this in just a second and how it's actually considered now a sham. How about joint replacement? There's so many people that say, I can't wait until I get my knee replaced or I get my hip replaced. And I get it, I understand it, that the joint hurts and that getting the joint replacement surgery, people say, it was so wonderful, I feel so much better. But I guess it still doesn't get to the reason why that joint deteriorated in the first place. And not only that, is that you're starting to embed a metal or a foreign body into your joints, which is considered foreign to the body, that the body has to start breaking down because it looks at this and says, you don't belong here. Or doing a joint fusion, which is so weird for me because a joint, in order for it to be healthy, needs to actually move. But they say, you know what, if it's bothering you and it hurts, maybe we'll just fuse this together, whether it's a thumb or whether it's within the spine. So they often fuse the two joints together, okay? So I want to give you an example of just really how crazy this is. This is in PubMed. Yes, I actually found it on the internet, PubMed. And this comes from the British Medical Journal of May 11, 2017. Here's what they said. Knee arthroscopy versus conservative management in patients with degenerative knee disease, a systemic review. And here's what the article says. We included 13 randomly controlled trials and 12 observational studies. So they took a pool of 25 different studies. So they said knee arthroscopy results in a very small reduction in pain up to 3 months and a very small or no pain reduction up to 2 years. So when someone says, I'm going to go and get my knee scoped and I'm going to clean it out, I'm going to debride the joint, basically after 3 months, had a very small reduction in pain and a very small or no pain reduction up to 2 years. Knee arthroscopy results in a very small improvement in the short term and very small or no improvement function up to 2 years. They're saying it doesn't work. Why are we still recommending it? Conclusions over the long term, patients who undergo knee arthroscopy versus those who receive conservative management strategies do not have important benefits in pain or in function, okay? Which is why I don't know why we're still doing it. Hopefully doctors aren't still recommending this, okay? Now, what about knee replacement? Because you're seeing that this right here is absolutely exploding. Knee replacements, people running off trying to get their joints replaced. By 2030, this is actually the American Academy of Orthopedic Surgeons, by 2030, which is in just less than 8 years, total knee replacement surgeries are projected to grow 673% to 3.5 million procedures per year. About 60% of all knee replacement operations are performed actually on women. Approximately 85% of knee replacements will last for 20 years, which means that you can outlive your knee replacement, which is not good news. Nearly half American adults will develop knee osteoarthritis in at least one knee in their lifetime. Well, wait a second. If it's old age, why isn't it happening in both knees? Or if it's genetic, why is it happening in the left knee or the right knee if you have genes that are occurring in both knees? 80% of osteoarthritis patients has some degree of movement limitation, which is interesting. They have a lack of motion. More than 90% of people who have knee replacement surgery experience a dramatic reduction in knee pain. Well, of course, because you got rid of the worn out joint surfaces and replace it with an artificial joint. So I didn't say that it doesn't necessarily work, but we have to ask the question, why? Why is this happening, and why is it going to go up 673% to 3.5 million procedures a year just in the United States? Let's talk about how to start handling this, because arthritis is a symptom. It's a symptom of a much bigger problem. In fact, when you look at the whole arthritis, what it means, arthro means joint and itis means inflammation of. So when you have people walking around saying, I got a diagnosis, it's arthritis, basically the doctor's diagnosis is saying, I have inflammation of a joint. It's inflammation. So it's the body trying to heal and trying to repair. So here's a different approach when it comes to arthritis. And you have to look at it from a different perspective, and you have to look at it not with just one thing. It's not just your nutrition. It's not just stretching it out. It's a lot of different things that you have to do, and hopefully, guys, this will make sense. So I coined this, and it's called AIM. You need alignment, you need to reduce inflammation, and then you need to start moving it. And I'm going to give you some examples so that the light bulb starts to come on, so that you understand when it comes to arthritis. Arthritis is a symptom, again, of a much bigger problem. Let's talk about alignment, for example, because I want you to think of this. Here is a tire that is balanced. Here's a tire on one side that's not balanced. Here's a tire that's balanced and unbalanced in the other direction. And so if you have a tire that looks like this and you decide you're going to drive it, well, no wonder the tire is going to wear down, okay? Now, this is almost what we do, is that we say, oh, I have some knee inflammation. I'm going to rest it for the next 2 months. And lo and behold, the knee, the lower back, the ankle, the shoulder, the hip, wow, it actually feels better. And I'm like, that's no different than going and parking your car in the garage for 2 months and then coming back out and looking at the wheels and say, wow, there's no more wear on it. Wow, that's really amazing. Well, because if you are going to rest it, of course the inflammatory process is going to go down because you're not doing anything to actually start to trigger it. And so if you don't want your wheels to wear away, then they need to be aligned and balanced. And if you want your joints not to wear down, they need to be properly lined up and they need to be properly in balance. This is why we look at so many things, from the feet to the knees to the hips to the pelvis to the lower spine, looking at leg length inequalities and things like that. If it's not in the right alignment and you're using it, then it's going to wear down faster. Take your feet, for example. So just like I showed you, hey, here's your tire, what about your feet? If your feet actually turns out, that's known as supination, leaning out. If it's leaning inward, in which is pronated, and by the way, most people do have severely pronated feet. One of the reasons why is the footwear that you use. You are using heavily cushioned with a raised heel, like a running shoe, that actually will cause your arches to collapse because it's kind of like wearing a back brace all the time. It causes the intrinsic muscles of the feet to start to atrophy. If you are in normal, guess what? Normal foot alignment will actually lead to normal knee alignment, which actually leads to normal hip alignment. And guys, I want you to think, your knee is just a hinge joint that is basically taking the brunt of what's happening at the hip and what's happening at the foot. The knee, just think about it, you don't walk on your knee, you don't walk on your hips, you walk on your feet, which is the foundation, and you have a quarter of your skeleton in your feet, which God said the feet are pretty important, not only for walking, but for balance of the rest of the body. Now, here's the other thing. What about alignment of the spine? So I see so many people who have this posture right here, and it's known as forward head posture. And you can see that the ear should be directly over the shoulder, but when this starts to go forward, all the weight actually will start to the weight gets bore on the disc, and the disc will start to break down pretty quickly. And the reason why is the discs aren't meant to bear weight. So you think of this, even what we do with feet alignment, about bringing the head back out of a forward head position. You go to the doctor, they're never measuring these things. If someone has neck pain, they're giving them drugs or maybe trying to do like some physical therapy, but they're not actually restoring alignment with a pre and a post x-ray so that we know that they're moving in the right direction. Now, what about inflammation? Sue, if you are systemically inflamed, the area that is out of alignment are the ones that are going to start barking first. This is why when I get inflamed, I will feel my lower back, because by the time I was 22 years of age, I did have a disc herniation. It wasn't genetic as much as me running around on a spine that was not in the right position. And so even when I get inflamed and I do something that increases inflammation, I will feel in the areas where I've had some joint damage take place. So you have to start measuring what's happening chemically inside of the body that's causing systemic inflammation. Now, a couple of weeks ago when I talked about cancer, and I talked about your insulin resistance and cancer, how it leads to cancer, guys, this is why it all parallels together. The other thing that is going to cause a lot of your soft tissues to start to erode and become inflamed is actually your insulin levels. So going back to this study, they talked about cancer and insulin, and they also talked about hyperglycemia and insulin resistance, meaning elevated blood sugars due to the inability to be able to hear insulin anymore, increase what is known as advanced glycation end product formation. The production of intracellular age precursors damages target cells by modifying proteins and altering their function. Advanced glycation end stages due to issues with blood sugar and insulin resistance. And I had this slide up 3 weeks ago, and some of you said, I never thought of it this way, but problems with blood sugar will lead to damage to soft tissues. So what are your soft tissues? It's your skin, it's your blood vessels, which is why there's such a high amount of stroke and heart attack with insulin resistance and blood sugar issues. It's why so many have cataracts. If you have cataracts, you have a blood sugar issue, okay? On top of that, problems with changes within the urine, urinary incontinence. But also, if you look at this, these advanced glycation end stages will end up damaging the cartilage of your joints. This includes the discs of the spine. This includes the knee cartilage, the hip cartilage, the ankle cartilage. And basically what happens is you're going to get damage to those areas, and it will damage soft tissue, which means that if you have elevated blood sugar, which is the end result, and before you should be testing your insulin levels, and if that is, basically what is happening is you are moving towards a slow progression of having stiff and damaged and inflamed joints. Yet no one is talking about that from an inflammatory level. And here's the third thing we talk about when it comes to movement, okay? About movement. Because we say, oh my gosh, I got arthritis. I guess I should just quietly go in the night. I think I should just stop squatting. I think I better use a walker, use a cane. Rather than saying, what do I need to do in order to start restoring movement? Because movement is life actually to the joints. And I'll give you a perfect example. If you broke your arm, you fell down, you're going to go to an orthopedic surgeon. I had someone reach out and said, hey, my daughter broke a bone. Can you put a cast on? I'm like, I don't know if you've been following me. I'm not an orthopedic surgeon. No, I can't. My license doesn't allow that. You need to go to an orthopedic surgeon. That's where training is. They do an excellent job of casting something and approximating those bones together. So what they have to do is they have to cast it together, and then they have to immobilize it so that the bone can start to grow together without it getting interfered with. Now, let's say 6 to 8 weeks later, it's healed, the bones have approximated, they're still healing because it takes 9 to 12 months, but it's strong enough not to need the cast. And you get this cast off, and guess what you're going to see? You're going to see an elbow and a wrist and a forearm that, number one, has atrophied. It's gotten weaker. You're going to see that it's very stiff. You're going to see that it's very painful when you try to move it. So I want you to think about it. You casted your arm for 6 to 8 weeks, and now it's weak, it's stiff, and it's very painful. Isn't that what arthritis is? And so sometimes arthritis is because you're not actually moving it, and once you move it, for a week, start seeing how stiff and weak and painful it actually is. So that orthopedic surgeon is not going to look at you getting that cast off and say, you know what? I think you have arthritis. Maybe we should just schedule your next joint replacement, or maybe give you some NSAIDs, and you know what? Just take it easy. No, what they're going to do is they're going to say, you need to start moving it, and even if it's painful, tough luck, you need to start doing it in order to get function back to the joint. And notice they do that when it comes to a break, but they're not necessarily doing that as aggressively when it comes to people coming in with the very same conditions because they haven't moved something for 5, 10, 15, or 20 years. You have to start restoring movement back to it, okay? So, aim, alignment, inflammation, and movement. So here's what you have to do. Now, alignment is that you need to find a chiropractor who does some kind of restorative care. Which is why in our office we do pre and post x-rays, because we need to see that people are moving in the right direction. Things like correction of cervical lordosis, forward head posture, scoliosis correction, actually looking at, chiropractors should know how to adjust extremities like shoulder blade, the feet, wrists, things like that, in order to restore alignment. Number 2 is that you need to find someone who knows how to test and knows how to know what your inflammatory triggers are. At a basic level, you should be looking at food allergies, you should be measuring your A1C, you should be measuring your insulin levels, which should only be 3 to 5, ideally. Yet most people are walking around at 15, 20, 25, and today we had an individual that was at 900. And then measuring C-reactive protein, which is basically a systemic inflammatory marker. This should be under 1, yet I did a consult with a person who was at 26, another person who was at 5. Highly inflamed people, and you know what one of their complaints was? All my joints hurt, okay? And then the third thing is movement. How do you restore movement back? So once you get alignment, once you start lowering inflammation, a lot of people say, oh, I feel so much better. And I say, yeah, but if you want to get more function back, you need to learn how to move it properly so that it doesn't continue to come back. And that right there, if we have enough people who say, yes, please teach me about movement, and this has to do with some things in regards to mobility of the spine, mobility of the shoulders, mobility of the hips, mobility of the actual ankles, and we can show you some awesome things. We can probably do a live video from our gym and show you some things, very simple things that you can do at home in order to start restoring movement to those joints that will help with range of motion, especially if you guys are working on alignment and you're working on lowering your systemic inflammation as well, okay? Now I know that I'm gonna have this question. They're gonna say, wait, Dr. Nate, what about ice? What about ice, or what about heat, okay? I'm gonna say this, I don't do either. I don't do either. You mean to tell me, Dr. Nate, that you don't do ice? Yeah, and prior to about 1978, when this doctor came out with the RICE principle, rest, ice, compression, elevation, no one used ice either. And in fact, if you want to stay perpetually injured, start using ice for acute injuries. You're probably gonna disagree with that, but I've done a video on why I never, ever, ever ice. And I want you to think about it. If you have tissue injury, you need the inflammation acutely and you need the swelling for the actual immune system to go in and start repairing, digesting damaged tissue and start laying down new tissue known as scar tissue into that area. So you don't ice it. You actually start moving it as quickly as possible. And this is why, guys, I will never put ice on any one of my joints. And I've actually had a grade 3 tear of a hamstring and I did not use ice and I was back to almost full participation within 2 weeks, when most of the time they're saying it's going to take 3 to 4 months. It will only slow down the healing process, much like NSAIDs in the first place. That's why I never ever use ice. So guys, we're 1 day away from our inflammation talk. That's tomorrow, June 7th, 6:15, right here at Exemplify Health Center. And we're going to talk about inflammation, guys. And once you guys start to understand inflammation, you're going to understand why literally doctors are scrambling to try to manage inflammation or try to knock out inflammation from a drug perspective. But meanwhile, we're saying inflammation is a spark that leads to every single disease out there: weight loss, resistance, cancer, infertility, thyroid disease, arthritis, type 2 diabetes, autoimmunity, hormone imbalances. All starts with knowing how to correct inflammation first and foremost, from a physical, from a mental, and from a chemical perspective. And within the Wellness Way, we're the only doctors who are working on all three. And we are experts in carpenter work. We're not experts in fire department work. We're experts in being able to identify causes. We are the best crime scene investigators to figure out, according to labs, what is wrong. And we're the best as far as being the carpenter to rebuild and repair your body, either to prevent a fire from happening, or if there was a fire, to build your body back so that it doesn't come back again. So you guys can go to the very top of the page. We might be all registered. I don't know, because I've seen a couple actually come through on my phone. You can see if we still have some space available for that inflammation talk. This is an in-person event. This is not an online event at all. But guys, I want you guys to mark your calendars if you are from the Yorkville and from the surrounding areas. At the end of July, we're going to be doing a 4-week immersive event in person with men only, and it's called Man Up: How to Increase Your Testosterone Without All of the Gimmicks, without all of the commercials, about how to take these testosterone boosters. We're going to talk about the biggest things that are interfering with a man's production of testosterone. And not only that, we're going to apply those principles into lifestyle, which is why we're going to do some awesome things when it comes to fasting, intermittent fasting, detoxing off of sugar, making sure, going over sleep strategies, making sure, teaching men how they should be working out, how it should feel while they're working out. And we're also going to teach them some other things about self-defense and things like that. So that is coming up. You will see that registration start to come up within the next 2 to 3 weeks. I believe we're kicking off July 23rd, and it's going to be a 4-week event. And that will actually be with me every single week. It's going to be an awesome, awesome event. And I tell you what, we have taken hundreds of men through this, and they have said it has been a life changer for me. They've been thankful, but you know who's been the most thankful? Their wives and their significant others. Because they say, I married this man, but he's turned into my roommate. He's really nice, he's really agreeable, which is a symptom of low testosterone, but he doesn't have the spark he used to. And this whole idea that testosterone goes down with age is completely just as a myth as arthritis is due to old age. Because we've taken people in their 50s into testosterone at 300, into 800-900 in 3 to 4 months, and they get older, but their testosterone actually gets better. So just pay attention to that. That will be coming very, very soon. You'll start to see some things about that, probably coming up at the end of June, which is going to be here right before you know it. So guys, if you enjoyed this, please make sure that you share this with other people. And if you want to see part 2, in which we'll actually demonstrate some things on how to start bringing back motion to specific joints, that will actually help you move better, that'll help, even with pain, that will help with range of motion and things like that. Just put in the comments, yes, I want that. I'll be happy to do that if we have enough people that would be willing to watch for that live video. So if that is you, please make sure you do it. And as always, I always appreciate you guys sharing. So it is always a joy. It's always an honor to be able to share with you. I always appreciate all that you guys have done when you share these videos. And please don't stop. We have a mission to change healthcare as we know it. And that's not going to happen unless we're doing it together. So guys, have a great evening. I'll be jumping on probably on Wednesday with some more awesome things. I hope you have a great evening again. Be well, be blessed, and remember to start looking at health from a different perspective. We'll see you guys soon.